In this tutorial, we're going to teach you how you would do basic life support, including chest compressions and giving manual breaths, if your dog or cat were to suffer from cardiopulmonary arrest while away from the hospital. If your pet isn't breathing and you can't see his chest moving, if he has lost consciousness, and the last piece is if you can't feel a pulse. And so to feel a pulse, you might want to put your hand on the inside of his thigh and see if you can feel a pulse there. If all three of those things are not happening, then you immediately want to start doing chest compressions. In most dogs, you're going to want to put one hand over the other, and depending on the size and shape of your dog, larger dogs, you usually want to put your hand kind of over the widest part of the chest. And it's important that you can have your arms are straight, your elbows are straight. And so if you need to put your dog onto the ground in order to have straight elbows, you should do that. If you have someone to help you, you can also do mouth to snout breaths while you close your pet's mouth and put your mouth entirely over their nose and breathe in to give a breath. If you're by yourself, you can also do this by doing 30 compressions and then 2 breaths and alternate back and forth. To get the rate of your compressions just right, we recommend doing them to the beat of the popular 70s song by the Bee Gees, Stayin' Alive. If that's a little old for you, you can also do it to the tune of Baby Shark. Now, if you have a cat or a small dog, you're going to want to use probably a one-handed technique where you figure out where your pet's elbow kind of comes back to meet her chest, and then you can do a one-handed compression technique like you see here. You can also use 2 hands in small animals. It just sometimes can be a little bit harder given the size of their chest. We hope that you never have to use these techniques, but if you do and you are successful, you're going to want to make sure you get your pet to the nearest veterinarian as soon as possible for further care.